Go.
Hello, I'm Nicole, Child and Family Health Nurse from AWARS. We're here today to talk to you about Autism Awareness Month, which is happening in April. And here at AWARS, we're just trying to promote some awareness around autism. And today we have Karina here with us, who's a paediatrician who works with us here at AWARS, and I've just got some questions for her about autism.
Sure.
So first of all, Karina, I just want to ask you, what is autism?
Sure. Autism is a brain condition that kids are born with. It affects them in different ways. So every child who has autism is different, just like all human beings are different. It affects the way kids talk. It can affect the way they interact with others at home and at school or at preschool. It can affect their behaviour, and it can affect their senses, how they interact with the world, how they feel about sounds and how they feel about touch and things like that. And often kids with autism have a particular interest that they're really interested about, and they might want to do that instead of doing other things.
Okay, so if a family member or a carer or a parent is concerned about their child and think their child is showing some of those interesting behaviours, what should they do?
Come to AWARS if they're concerned. Depending on the kid's age, if your kid's a younger child, then you're going to be in contact with child and family nurses, so to talk to them. Come in for a kid's health check is probably the best way to start, and see a GP and see the child and family health nurse, or if you're older, to start with seeing the GP, and they'll work out who you need to see. It might be the speech therapist, it might be an occupational therapist, it might be a paediatrician down the line.
I suppose one of the things I hear is that families worry that this is going to be a big problem for their child, and sometimes there's some shame involved in getting help for their child. What would you say about that?
Yeah, I mean, I suppose speaking as a parent myself, it's really hard if you're worried about your kid, and you, like, I know as a parent, I kind of want to keep them in my family and not see anyone. I suppose the reason we might diagnose autism is to make sure the family gets the best help and the child gets the best help, so they can reach their potential. But I think the thing about autism is that every child with autism is different, just the same as every human being is different. So recently I had a little 5-year-old who was diagnosed with autism, and when we explained it to them, when his parent explained it to him, he was like, "Oh, so is autism my superpower?" And I'm like, "Yeah, that's right. Autism is just about being different, just like we're all different, and it has some things that make kids really strong, and it also might give them challenges."
So I suppose the bottom line is that we're here to celebrate the differences that
Absolutely.
kids have,
Yep.
and to help them reach their full potential,
Yep. Absolutely.
their deadly potential. Well, thanks for coming to talk to us today.
Absolutely.
Karina.
No worries.